Namaste and happy International Day of Yoga to all our viewers. Today, as we celebrate the spirit of yoga, the Symbiosis Centre for Yoga brings to you a special podcast dedicated to exploring the transformative power of yoga in healthcare and well-being. To take this discussion ahead, we have with us an eminent and distinguished personality who herself is a physician and advocate of yoga therapy. She is the founder of Param Yoga and Autoimmunity Treatment Center. She is also author to two books called Power of Pranayama and Power of Posture. Let us welcome her to the podcast, Dr. Renu Mahtani. Dr. Renu Mahtani, a warm welcome to Symbiosis Centre of Yoga podcast. Dr. Renu, you are a physician as well as the advocate of yoga therapy. What was the turning point, or when did you think that healing is also required along with the medicines?
When I was working in the intensive care unit, it gave me enough experience and introduction to realize that any acute problem, medicine has to be looked upon. But when a chronic lifestyle disease sets in, like it happened with me, I was struck with psoriasis. It's a very stubborn, nagging skin disorder, very embarrassing, very harassing. My palms, my soles, I couldn't touch my patients also, it was that bad. And then I realized that it's not just my body, I have to look deeper and go beyond. And I was lucky to get introduced to pranayam at that stage of my life. And that's how yoga entered for me. It was through the breathing exercises. So I learned pranayam properly when it was actually not very popular. And I started practicing it myself. And I did see a significant positive change, not only in the improvement of my skin, but of the way I used to think, my mind, a feeling of happiness, a feeling of satisfaction, energy, more energy for myself. And that's when the whole thing came that this has to be explored more. And I literally ventured out to understand this philosophy and science of yoga from almost 6 institutions. I took my training. And then my patients started asking me that, ma'am, you've learned so much, why don't you take a session for us? And that's how Param Yoga came in. I mean, I had never thought I'm going to start a yoga institution. But looking back, it has been a wonderful journey, 20 years. And everything was going well. My skin was improving, life was stable. But the story didn't end here. I got a second episode of psoriasis. And then I was wondering, hey, I'm doing everything. I understand body, breath, mind, my life is not very stressful like it was that time. Then why am I getting the second episode of psoriasis? So then I ventured out to do a training in nutritional and metabolic medicine. Because even my doctor's mind was saying that mechanisms are cellular. Problems are deep inside the cell, my immune system, and they also need correction. And that's how vitamin D came into my life. The potentials of vitamin D in therapy of autoimmune diseases, which I was not aware of, although I am a physician. And I started getting into that deeper. And not only could I come out of my second episode of psoriasis, but it became a calling for me. And then I realized that it's about both hardware and software. So when I'm correcting the vitamin D of my patients and treating them, it's like making the hardware good and strong. And then when I add the software of yoga, pranayama, mindfulness, awareness, it definitely works better. So I think my psoriasis was actually a blessing in disguise for me, because it showed me to come out of my tubular vision and get a bigger picture of health, which integrates body, mind, and a beautiful link of breath. And in fact, that's how my first book came, Power Pranayam, which is very much there. And it's there in 5 languages. And I think breath is very, very important. And my life journey has completely changed for the better, for the good.
Thank you for that answer, ma'am. And you mentioned two, three things which will come, like you'll discuss one by one. Before coming to that, we, as a layman person, and there are people and students who are curious about knowing what is yoga and what is yoga therapy. They really do not understand the difference between yoga and yoga therapy. So, can you just throw light on these two terms and to make it easy for people to understand the difference between the two terms?
Good question. So, well, it all starts with yoga, right? And the word yoga has become popular. So, let me first clarify that I don't hesitate in accepting yoga, because for me, your own great awareness. A stands for awareness, and without awareness, any aspect of yoga is, I call it, lifeless. So, yoga. When it was conceived many years back, that time the body of man, let's say human being, was very different from the type of bodies we have now, right? Hence, this demarcation gets in yoga and yoga therapy. So, yoga that time was conceived for a hard-working body, tight muscles. Tight means tight, short muscles which need to lengthen and stretch with the physical postures. So, that brought the concept that, oh, yoga is only stretching. Yoga is all about flexibility. Okay? But today, our muscles are not tight. We are more on the laxer side, right? The muscles are flabby. It's like, an old rubber band which you are trying to stretch. And if you overstretch a lax muscle, it's going to cry with pain. So, this is what is happening today. Point is, our muscles have changed. So, the term yoga therapy. Yoga was not just stretching. Even Rishi Patanjali in his Yoga Sutra says, Sthiram Sukham Asanam as the definition to yoga. Now, what is sthirta? Sthirta or stability. It comes only when the core of my muscles is strong. So, I need strength first. And on the foundation of strength and stability is the sukha, sukham, the sukh of stretching or the sukh of flexibility. And that is asana. So, yoga has never been only stretching and only flexibility. Flexibility based on strength. And that is therapy for today. If you are looking to only flexibility, we are going to destabilize our joints. So, we need the foundation of strength, we need the foundation of stability, and then enjoy the flexibility. That would be therapy. And that brings me to my maxim: how you do is more important than what you do. Unfortunately, in the asanas are given qualities that XYZ asana is good for the back, XYZ asana is good for the shoulders. Same asana, if done incorrectly, can harm. But if it is done with correct awareness, and awareness here means alignments, correct alignments between the bones, the same asana is going to be of help. So, it's so important to realize, how am I doing my asana practice? And that is yoga therapy. So, finally, yoga therapy would be when my bones are well aligned. The bones have to be stacked one on top of each other in the correct alignment, the way nature has designed. Now, if the bones are out of line and I am doing an asana, I am going to destabilize my joint. 2, these bones have to be cemented with right muscles. And muscles means balanced muscles. Unfortunately, our today's lifestyle makes certain muscles very tight or certain muscles very lax. It's like extremes. And then there's a tug of war going on between the tight muscle and the weak muscle. And who suffers? The joint in between. So, if I have to correct my joint pains, I have to also see that my client or myself, I'm using my muscles optimally. So, how does that happen? Stretch the tight muscle and strengthen the weak muscle. That would be yoga therapy. So, today's need of the time is that we, all yoga therapists, need to know all this. It's not just an asana how it is done, but which muscle is it strengthening? Which muscle is getting stretched? This basic knowledge is very crucial to see that finally all yoga becomes yoga therapy.
So going ahead, ma'am, you also mentioned about vitamin D therapy and also the pranayam. So you started with mainly the breath. But now coming to breath and also mentioning Patanjali Yoga Sutra here, and when we talk about Ashtanga Yoga, Yam Niyam Asana Pranayam Pratyahar, so always asanas come first. But in a case where a person is not able to move, so I mean, if we start with pranayam immediately before making the body move, or before performing mild asanas or maybe gentle asanas, would that be recommended?
Of course,
And
absolutely.
yeah, and I would also like to throw some light on what pranayama did you start, or anyone who's going through the same case as you had gone through, or the situation you had gone through. What would be your suggestion? How can they start their yogic journey?
So, friends, breath is life. We can live without food, we can live without water, but without breath. So, having that notion in mind that till I master asanas, I cannot do pranayam, I'm sorry, please come out of that. Right? We have to be open minded. Yoga is about flexibility of the mind also. If my mind is rigid and I'm not ready to live in 2023 and 26 and beyond, I am really not practicing yoga. So, in today's time, as such, and even otherwise, if I can do something to my breath, I can do a lot to my body and mind at the same time. That's the beauty of the breath. You know, the Pancha Kosha concept of yoga, Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha. So, the Pranamaya Kosha can deal with both Annamaya Kosha and the Manomaya Kosha. So, breath is very vital. Even if the patient is bedridden, they can take some deep breaths. And if nothing, chanting. Chanting is so powerful. And if nothing, just correcting our faulty breathing habits is the need of time for the most educated people also. Our basic breathing culture, which we are following on the tables, working, driving, needs correction. Many of us, in fact 50%, are paradoxical breathers. Our breathing is following the reverse pattern. So even if we can correct that, it's like charging our batteries up. So breathing is so very, very important. Okay. Now your second part of the question was that how to start. So I would make it easy and simple for all. Let's suppose today I have to change the furniture of my room, right? Before I get the new furniture, I have to remove the old one, bring the furniture in, and then organize it. Same thing with my body. I want to get the power of the good breath inside me. So I have to remove the unwanted. Hence comes the role of Kriya, like Kapalbhati. Okay. So, if nothing else, few minutes, 2-3 minutes of good quality, right Kapalbhati, because here also how I do Kapalbhati matters than just doing it. For even a longer time, it doesn't matter. It should work on my body and on my mind too. So Kapalbhati is like a cleansing act. You cleanse the old furniture, and you get the new furniture with the deep breathing you do. It could be in the form of Anulom Vilom Pranayam, right? Few minutes, 2 minutes, 3 minutes, 5 minutes, Anulom Vilom Pranayam. Once again, correctly done. I always use this word, correctly done. And then you want to distribute the furniture and keep it at the right place. So some humming, simple Brahmari, humming, chanting, it's like a massage, You're vibrating your cells and it's like you're arranging the energy in your body, directing the energy to where it should go. So even if these three things can be done, although pranayam is a vast science, and trust me, there are techniques of pranayam from India not known in India, documented in the West, right? Like special techniques for anxiety, depression, learning disorders, and all. There's so many which need to be propagated. But as a common thing, if I can just correct and get the right furniture inside me, Kapalbhati, Anulom Vilom, or Ujjayi, followed by some chanting, even that 15 minutes a day can transform the life.
Ma'am, next question, as our viewers are going to be students, and as you know, the recent generation, Generation Alpha, or Generation Z for that matter also, they are used to a very fast paced lifestyle, and yoga is all about slowing down. And when you preach about yoga or you want to motivate them to do yoga, it becomes difficult because they have this friction or resistance against slowing down. Whatever they enjoy is more of related to sympathetic nervous system, and they don't want to really calm down their parasympathetic nervous system. So what message or how can we really make yoga popular among this generation?
Such a relevant question, such a relevant one. Thank you for asking. Yeah, I know we face this. Sitting in my clinic also, I see youngsters coming and saying, I'm very stressed out. I want to join meditation. Hey, when you're super stressed, you cannot meditate. It's impossible, right? You may go for a retreat, enjoy the natural beauty, and come back, and you're back to the same rut. And then this young generation wants, what should I say, quick answers. Tell me one asana for my thyroid problem. Right. Tell me one asana for blood pressure. It's not like that. So, how to deal with such minds? If you tell them to meditate, they're going to run away. Yeah? So, we have to engage the mind first. And that's why the body. Engage the body first, right? And I think the best thing is Surya Namaskar. Sun salutations is such a wonderful set of exercise. And even, it's rated as the #1 form of fitness. I think it's upon the teacher also to promote how you promote yoga, the confidence of the teacher. 95% muscles of your body work in Surya Namaskar. No other exercise can ever do it in that 10-15 minutes of practice. So we need to get those practices which engage them, which involve them, right? To start with. Kapalbhati, they will love it. Chanting, they will love it. But if I tell them on day 1 to do 15 minutes of Anulom Vilom Pranayam, they will run away. So I think we have to get them involved first. And after they have been engaged, they are tired, then give them an introduction of a good quality release and relaxation.
And the next question about yoga therapy is, what are few misconceptions you have come across where people are resistant towards maybe taking up yoga therapy? I'm sure you must be counseling a lot of people.
Absolutely. First and foremost, yoga therapy is already a part to some extent of, let us say, physiotherapy. Like for example, so many practices which are sort of taught to the patients are from yoga, like bridge pose, Setu Bandhasana, back stretch, Pavan Muktasana, you see. So it's already there to some extent. But yes, what people think about yoga therapy, the misconceptions. First, biggest misconception is all yoga is yoga therapy. They think, oh, I'm in pain, let me join any yoga class. That is not the way, It has to be customized because it's not a one size fit for all when somebody is suffering. Second misconception is just using props only is yoga therapy. Props means a yoga block, ropes, bells. They are important because they help bring alignment in bones. 2, they help to stretch tight muscles. Fine. Very important part. But self-practice means self-strengthening of muscles cannot be done with props. So strengthening of the weak muscles is a very important part of yoga therapy. Yeah. So only props cannot be the full stop when it comes to yoga therapy. So we have to come out of these. And third, overdoing. People love to overdo. But when I'm in pain, I have to slightly underdo the practice. And then the safety is mentioned. So these are the few points which have to be generated out and the misconceptions removed.
You have seen cases where only yoga therapy has helped completely without medication.
See, when I talk of yoga therapy, I look at it from the body perspective, from the mind perspective. Okay? So let's come to the body part first, when somebody is in pain. Yeah? So when there is acute pain, there's an acute disc prolapse, for example, then medicines have to be taken to reduce the inflammation and give relief from the pain. You can't just say that, come on, do yoga, because the muscles have gone into spasm, maybe. It's tough at that time to, in fact, they need rest. There's a time of some medication and rest. But once the acute phase is over, and when people are looking for exercises, say yoga or whatever, that's the time nothing can beat yoga therapy. I mean, I have had cases who were advised disc surgeries, right, when the acute phase was over. And we've been able to bring them out of surgeries with right exercises, right alignments, and posture awareness. See, I may be doing the best of yoga therapy, say 1 hour a day. How do I carry myself? The balance 23 hours decides the outcome. So, well, that's what gave rise to my second book, Power of Posture. That right exercise, right attitude, and posture is not just about sitting straight. It's about how I'm walking, how I'm carrying myself in my day-to-day activities as well, and how I'm exercising correctly. So once all these things are introduced, we can definitely help the people out from many things which are painful, traumatizing, expensive, whatever you want to call it. So I would put it like this for the physical part. Now comes the benefits of yoga practices on the mind. Let us call them the stress-borne psychosomatic or lifestyle disorders. Well, lifestyle word means what? It should be a part of my lifestyle. So the earlier these practices are incorporated into our lifestyle, the better are our coping skills, mechanisms to deal with the problems and stressors when they come. So it will be a great thing that, it's a part of not just training the doctors and medical education, incorporating these therapeutic principles of yoga for the body and mind, but it's happening already in schools and colleges. It should be a part of the regular routine. And then the handling capacities are better.
So, coming to the next question, ma'am, what is the one yogic principle that has transformed your own life, and one message you would like to give to our viewers?
There's a very nice saying by Rishi Patanjali, Tataha Shriyate Prakash Avarnam. Then the veil from the mind gets lifted up. And I see this happening the more and more we get into the field of yoga, and especially breathing, mindfulness, it builds awareness. And the problem is today we are leading lives unaware. It's like the consciousness element is much gone. So I think that is the principle that hit me, that awareness. It comes, the veil from the minds get lifted up, there is more clarity of thoughts, clarity of visions, and through these practices, it sort of spills outside the yoga mat, and it spills out into every aspect of the life in the long run. And it's a journey which is so beautiful that there is no looking back.
So, now having experienced both the worlds, which is medicine and yoga, what has each taught you about the true meaning of healing?
Medicine teaches hardware has to be in order. Yogic philosophy and life is the software. Without a good hardware, the software results are not good, and vice versa. At the same time, I realized that I may be doing the best of lifestyle, diet, yoga, whatever, till my thinking is not on the right track. The real change doesn't happen. And that brings me to the crux of my 40 years of dealing with people, perception. Which lens I'm using to perceive a situation in my life will decide the outcome of my practices. And that does happen when awareness comes in. So, we also have to nurture principles of right thinking in our, the system of training, teaching, education, so that the attitudes, the perceptions are more, better and as needed for the time. Okay. And that affects the outcome in health as well.
So, ma'am, it was a wonderful discussion, and it was our pleasure to have you here on our podcast. And I hope our viewers like this podcast. And with this, I wish you all a very happy International Day of Yoga again. Thank you so much for viewing us.
Thank you for this wonderful opportunity, and wishing all the best to everyone. Thank you.